Hi, I'm Elizabeth Wise, the president of Lehigh Valley Hospital Pocono. Your health deserves a partner, and that's where we come in. Every month, experts from Lehigh Valley Health Network will discuss health topics with you in mind. No matter what's happening in our community or our world, we'll bring you the up-to-date information and tips to help keep you and your loved ones safe. Joining me now is Tammy Hess-Kiao, a clinical psychologist for Lehigh Valley Physician Group Pocono. Tell me a little bit about your role at Lehigh Valley Physician Group Pocono. What services do you offer?
So basically, Elizabeth, I'm a psychologist embedded into the primary care unit at the Bartonsville office, but I do get referrals from a lot of the medical specialties within the Lehigh Valley Health Network. So my goal is to integrate primary care with behavioral health. And one of the ways we're doing that, our primary care doctors are utilizing screening tools for depression in order to seek out those individuals who wouldn't be seeking out therapy themselves. But once they get referred to me, I offer short-term therapy for adults. And I deal with a lot of people with various concerns, whether it's depression or anxiety.
You know, I want to switch gears a little bit and talk about the recent pandemic and the current pandemic, really. Are there any trends that you're seeing related to patients or community concerns? What are you hearing?
Well, in the beginning, when the pandemic first started, I noticed there was an increase in fears and anxiety related to the whole COVID situation. Like even when you go to the supermarket, we were in a state of panic and the supermarket shelves were pretty much empty. You couldn't even find toilet paper back then.
Right.
But now I've been noticing people are more getting back to their normal routine, most people, but those individuals who have underlying anxiety issues, I've noticed are having a harder time adjusting to it. But I did see in the beginning more people were isolating, not only because of social distancing, but also because they had their own fears and anxiety. So that was increasing a lot of loneliness and depression in relationship to it.
Yeah, related to parents' anxiety about their children returning to school, what advice or thoughts or feedback could you give them within your current role?
The important thing to remember is that we have to make decisions that are best suited for the needs of our particular family. We all want the best for our children, so some families are going to be able to kind of adjust their work schedule in order to do this remote learning for their children, but other families won't be able to. So I think for those families, they have to use the best judgment in order to keep their children safe. And by doing so, I think since COVID is so ever evolving, I think they need to look to medical experts for that, to find out what precautions need to be put into place in order to do that. But in any decision making, I think they need to look at the pros and cons of their decision without it being driven by fear too.
Yeah, so it sounds like it's a very individual decision for the family.
Yes.
You need to think about what the medical experts and the data is showing.
Definitely.
And then make a best decision for you and your family, weighing the pros and cons, like you stated.
Definitely, and I don't think schools would be opening if they thought it was unsafe for the children, and they're going to be taking a lot of precautions into play.
Absolutely.
Yeah.
Based on what you're seeing and hearing, what interventions can be taken to support the patients in our community?
Well, I think a lot of times, I think individuals have to start doing more activities in order to stimulate their mood, whether they increase hobbies that they already enjoy doing or developing new ones, just to increase self-care altogether. I think also increasing exercise and staying healthy, like eating healthy, will kind of help boost their immune systems.
Right.
For those who are experiencing like loneliness or depression, online support groups might be a great option for them. And just the whole access to telehealth practices. I think the community should do that more as a whole. Like with Lehigh Valley Health Network, we did a great job of turning to that. Like without me being able to do telehealth services, I would never have been able to reach out to individuals at the height of the pandemic.
How was the telehealth experience for you as a provider? Because that's completely different to what you were doing, you know, prior to the pandemic.
Yeah, I think I find it great. I think it reaches out to more people, and you still get to see people's facial expressions and everything, and the patients are loving it.
Yeah, I was going to ask, have you gotten feedback from the patients?
Yeah, they really
about
enjoy
their
it.
experience?
They really enjoy it. It's so much more convenient for them and stuff.
Yeah, it definitely does make a difference, and it's another tool that we can offer to our patients.
Definitely.
As the pandemic continues, what types of patient or community concerns do you anticipate?
Well, I think the fact that a lot of people are losing jobs in a lot of the store closures, there's going to be continued store closures due to the toll the pandemic has placed on them. People are going to be losing health insurance, which is then going to impact their medical care. And especially these are the times, the stressful times that people need more of the behavioral health services. And now if they lack that insurance, they're not going to be able to seek it out. I also see a lot of increase in substance abuse issues. I think is gonna, we're also gonna see burnout regarding frontline employees. The frontline workers who were dealing with the COVID pandemic right from the start, I think it was traumatic, a lot of them, for them to see some of the incidents that were occurring and a lot of the deaths in the beginning. I also think there's going to be less access to behavioral health services due to more people seeking these services and the fact that there are a shortage in mental health issues. And just in general, in relationship to the family, like a lot of parents are dealing with a lot of anxiety and depression, and because of that, I think it's going to play a toll on the child's mental health, along with, I think we might see an increase in abuse rates within the families, which is concerning.
Right.
And then just in general, like the holidays are coming up, so that's a time where it's very difficult for people due to different family dynamics and the anxiety associated with it, but now with social distancing, it might be a little harder.
Yeah, I think that was helpful so that people can proactively anticipate this.
Yes.
But also tap into your service and then other coping mechanisms that have helped them in the past.
That's true. And even, I just wanted to mention too, like with student achievement, we might see that going down too, so parents have to be more alert for that, because when kids are doing that remote learning, a lot of them might have a hard time focusing on doing things like that, and just the building of social skills developmentally for children, that's going to kind of be taken away from them if they're doing that remote learning. So they're going to have to try to figure out with social distancing, kind of getting their kids into these environments where they can socially interact and develop those social skills.
So I just want to say thank you very much for joining me today and for sharing a lot of great information with us. Definitely things that people can use in their everyday. I think it highlights that there's a lot going on and that people need these interventions to be able to get back to really what the new normal in healthcare is going to look like.
Yeah.
So thank you very much for your time.
You're welcome.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN you have a partner you deserve.
We've seen the concern in your eyes. You're scared, nervous, want to know if it's safe. The answer is yes. At LVHN, you'll see the extraordinary steps we take to get you the care you need safely. At all our facilities, you'll see temperature checks for everyone, that we sanitize every surface, and yes, you'll see that masks are required. What we look forward to seeing is relief in your eyes. Lehigh Valley Health Network. Your health deserves a partner.
I'm here today with Joe Panzer, who's a physician practice manager for Lehigh Valley Physician Group Pocono. Welcome, Joe.
Thank you, Elizabeth. How are you today?
Thanks for joining me today.
Yeah.
I'm good, thank you.
Doing
So
well.
tell me a little bit about your role here.
Well, as a practice manager, we oversee all the practices, make sure that the patients are taken care of, the providers are taken care of, we have enough staff, everybody is safe when they come into the facility, that the doctors are seeing patients on a routine basis, that the patients can get in timely and are well taken care of here at all the LVPG practices.
Nice. You mentioned about safety.
Yes.
And, you know, people are hesitant. I'm hearing that in the community to seek health care, whether it be in the hospital, but also the practice setting as well. So what would be the first thing that you would tell people if they needed care and are really feeling hesitant to seek it?
Well, there's a couple different options for them, which are very nice. They can come in, they can come in and have a face-to-face visit. We can do a virtual visit where we can set them up so that they can see their doctor on a pad or a smartphone or whatever the case may be, and they can talk back and forth. The doctor can see them as well. Or if none of those options are available, we can do a phone visit where the doctor would call their house, whatever phone number they provide us, and then they would talk on the phone back and forth to the doctor and get some assistance that way. The main thing is continue to make sure you're talking with your doctor, especially if you're not feeling well.
You know, I think it's wonderful that we offer all those options, for our patients in our community. And, I agree with you. We should not be hesitant to seek health care because it could, be worse if people don't reach out to their provider. So thank you for that.
Even with the specialties, your cardiologist, your pulmonologist, people that have, let's say, chronic conditions that they're seeing the doctor, even their routine visits can be done that way if they don't feel comfortable coming in, and they should definitely keep up with their care.
Okay. And if there would be, the provider would determine whether you need a face-to-face versus a video visit?
Sure, both the provider and the patient can make that decision. If the provider does do a video visit or a phone visit with a patient, and during that time they decide, well, maybe I need to see the patient, then they'll talk with the patient, explain why they want to do a face-to-face visit and have them come in the office.
You mentioned about safety, and people are anxious about when they come into an environment that they feel safe. So tell our community a little bit about some of the precautions that we've put in place and what they can expect if they are going to come into one of our facilities.
If you're coming into one of our facilities, again, I want to stress our LVHN platform. It's our web-based platform, My LVHN. If you're a patient and you have that platform, you can do your e-check-in or your check-in, so you don't have to spend time at the front desk. You can fill out a lot of the paperwork, update your demographics. A lot of the things that we used to do at the front desk, where we have patients in the waiting room waiting, they can now do online. They can even, if they have a copay, they can even pay their copay through My LVHN. So that's a great time saver. It's a great way not to have to come in and be in the waiting room a few minutes longer. And then what happens if they can do that is, when they come into the parking lot, we ask them to call our office, and we may have them wait a few minutes in the car, and when they're called, we'll have them come up and we'll put them right into a room so they don't have to stop at the front desk because they've done their e-check-in on My LVHN already. And then they'll come into the room, the nurse will come in, do their vital signs, go over all their past medical history, all those kinds of things, and get them ready to see the doctor.
Okay. I think the other thing that I noticed when I walked into the facility is there's a lot of hand sanitizer. So that's available. And the other thing that I noticed in the rooms when you walk in is a visual sign that says this room was cleaned for you. So frequent cleaning of touch points and surfaces in between patients.
Absolutely. Once the patient does get into the room, they have their visit. Once they're done, the sign is actually flipped. On the back side, it says this room needs to be sanitized.
Right.
One of our staff members comes in. We have all the cleaning supplies, sanitizing supplies we need, and we wipe down definitely any place that the patient may have been or may have touched, door handles, the exam tables, the scales, even where doctors touch, for instance, the keyboards, the work areas, the counters, and everything else. Everything is wiped down, the signs turn back around so we know the room is clean and available for the next patient.
Yeah, that's very comforting to have those visual cues. So I'm sitting in a patient exam chair, so when I leave, it'll be cleaned. Yep. Okay, very good to know. So what if you ask a patient if they have concerns that a COVID-19 patient was in the exam room before them? What would you say to them?
Well, we have specific protocols in the offices for that.
Okay.
Basically, if it's a known COVID-19 patient,
Yes.
when they call, what we do is we have a room designated, or a couple of rooms designated in each practice that specifically for patients that we know are COVID positive.
Okay.
And generally what we do at cardiology, I can tell you, we would bring them in through one of our back doors. So when they call in the parking lot, we'd have them come in the back door here, come right into the room, sit down, and then the doctor would see them. Again, we're taking all precautions, both staff and doctors at all times.
Sure.
So that's not a problem. Once they would leave, we do have a special cleaning procedure that we would go through to clean the room. The room would be shut down for a few hours to do the cleaning procedure and make sure everybody is safe, and then reopen once those are all taken care of.
Sounds like we have a really good process in place, so thank you for that.
Sure.
I think one last question I get asked is there a visitor allowed to come in with me if I have my visit with my provider?
Right now we're limiting visitors to one.
Okay.
Just because of everything that's going on, trying to limit the number of people in the building and so forth. Yes, I mean, a lot of patients have anxiety about coming in by themselves, or some of our loved ones do need a little assistance.
Sure.
Maybe a little forgetful, whatever, so they bring somebody in with them to help them remember what the doctor tells them and so forth. So we do limit the visitors to one.
Okay.
And again, just to keep exposure down to a minimum. Of course, if you don't need somebody to come with you, we very much like to have just one person, but we understand that you may need some help. So
okay. So safety in mind, number one.
Yes.
But also support if somebody
Sure.
needs it and has a
Absolutely.
physical or another need that requires a companion to be
Sure.
with them. So I really want to thank you for your time today, Joe, and appreciate you sharing all the things that we're doing to help keep our community safe. And thank you for all that you do for us.
Thank you, and thank you, Elizabeth, for leading us and being a great leader here at Lehigh Valley Pocono Hospital.
Thanks.
This is a marathon, not a sprint. But we need to go back to work. Our kids need childcare. We need groceries. And sometimes we need a hug. But we also need to be smart. When you have to be around others, you need to wear a mask. It's clear that people without symptoms can be a carrier and spread the virus. So cover your nose and mouth, and let's work together to reach the finish line safely. Our community's health depends on it. Lehigh Valley Health Network. Your health deserves a partner.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN, you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN, you have a partner you deserve.
I'm joined today by Dr. Kimberly Downs, a pediatrician at Lehigh Valley Physician Practice, Pocono. So welcome.
Thank you.
You're new here, right?
I am.
So tell us a little bit about your training, your education, and what brought you here.
Well, I'm from Pennsylvania in my adulthood. I went to Penn State, and I've spent most of my adult life in the area. I did my training in Morristown, New Jersey with Atlantic Health.
Wow, nice.
And then I've been here about 2 months now.
Okay, I was going to say, how long have you been here? So welcome, happy to
Thank
have you. So as a pediatrician, what is your role? What do you do? Tell us a little bit more.
So we're involved in general care, and that is both preventative and for illnesses. And right now we're very busy with back to school physicals and vaccines, as well as doing a lot of virtual visits for illnesses and getting tons of messages every day through my LVHN portal.
And what age groups do you take care of?
We take care of newborns up through 18.
Okay, so wide range there, right?
Wide range, yes.
Okay, nice. So welcome, happy to have you here.
Thank you so much, happy to be here.
So you probably get asked a lot of questions from anxious parents about going back to school, about the pandemic. So I have a couple questions to ask you that will give more information to our viewers.
Okay.
So the first one is, I'm packing a lunch for my child that will be easy for the child to open all the items?
So for elementary school ages in particular, it's important to keep it simple.
Okay.
Engage your child in the process. So let them practice with the lunchbox, let them choose the lunchbox. We like those bento boxes they have a very simple latch to open, and then they can go straight in the dishwasher when they get home.
Nice.
Another option is what I use is just a nylon bag that folds down and fastens with some Velcro. Very easy for kids to get in and out of. When you're packing the food, again, simple is best. So a child can have too many choices in their lunchbox and they end up eating less than they would otherwise. So we try to limit it to about 3 things in the lunchbox. You want to keep a balance of protein, so eggs, chicken, hummus, some carbohydrates that are easy to eat, pancakes, pasta, sandwiches, and then include a fresh fruit or veggie. Carrot sticks are a great choice, celery, sliced up cucumbers, grapes, a peeled orange. And then, of course, a child should go to school with either a recyclable or refillable water bottle, because hydration is very important as well. And keep in mind when you're packing things like yogurt that you want to make sure that it's a packet that your child can open on their own.
Okay, nice. Thanks for
And
those
then-
tips. Oh, you have one more? Or a
One more
few
bonus tip from Dr. Thomas in Easton is to never pack hand sanitizer in your young child's lunchbox, because accidental ingestion of hand sanitizer can have pretty serious health consequences for a child.
That's a wonderful tip. I would have never thought of that.
Me neither.
Yes, so thanks for sharing that. So for children who may walk to and from school with their friends, is it safe if they wear their masks?
Yes, absolutely. And this is also a great opportunity to get a little exercise and socialization in. So it can be safely done. The most important thing is to make sure that a child is being screened every day for symptoms by their parents. So if your child has a fever, cough, or other signs of illness, they should stay home and you should contact their healthcare provider. If they're doing well, then children can walk to school together. Some important things to remember are that they should stay at least 3 feet apart when they're walking. They should wear their mask properly at all times over their nose and their mouth. Now, little kids may need some adult supervision to really make sure they're sticking with these guidelines. The older children in high school will be, able to follow these guidelines on their own.
Yeah, it's tough because little kids like to hug each other and hold hands, that you
Absolutely.
mentioned about. So very good tips. So as we go back to school and sports, is it safe to carpool? And what safety tips do you have if it is safe to carpool?
Okay, it is safe to carpool. Some things you can do to make it safer, because this is a very important transportation option for a lot of families as we head back to school. You want to keep a consistent carpool group. So the more often you change groups, the more likely you are to be exposed to illness. Again, screening any carpool member for signs of illness and keeping them home.
Sure.
And then other things you can do in the car is hand sanitizer before everyone gets in, sanitizing the buckles and the car door handles. And everyone should wear their mask in the car. If the weather is nice, roll down the windows, get some fresh air moving through the car. And then when you're seating passengers, try to seat them as far apart in the car as they can be.
Okay, thanks. One of the questions you mentioned about a temperature. Is there a certain temperature that you should be concerned about or not concerned about?
So we would generally consider a fever as 100.4 or higher.
Okay.
And so that's a fever that you want to contact your child's doctor about. And again, keep your child home at school until you've talked to their healthcare provider.
Okay, so it's always better to be safe than sorry.
Absolutely.
Okay, good. So one of the questions I get asked a lot is about packages and backpacks for kids that are going back to school. You mentioned about the lunch bags and the school supplies. So should parents be washing or wiping them down? And if they should, is there things they should be using to wipe them down?
Sure. So we're still learning about, coronavirus and how easily transmitted it is through contact, but you do want to be particularly cautious with high contact items. So things that children touch a lot, their shoes, their backpacks, their lunch boxes, their jackets. These are things that should be disinfected pretty frequently. So hard, shiny surfaces can be wiped down with a disinfecting wipe, and soft surfaces can be sprayed with a disinfectant like Lysol, and then everything that's machine washable can go through the wash at least once a week.
Okay.
Shoes can be designated just for school too, and even kept outside if that's something that is possible at your house.
Yeah, when I come in from work, I work in a hospital, I take my shoes off in the garage before I walk into the house.
Me too.
Okay. Those are really good tips, thank you. So it sounds like a lot of high touch surfaces that children frequently touch, whether it be a countertop or their backpack or something else, should be wiped down and cleaned.
Yes, exactly. It's the same as in flu season. You want to also keep an eye on door handles.
Okay, great.
Disinfecting those.
Yeah, thank you.
And then encourage children to use their own school supplies and not be sharing them with their classmates.
Okay, so you mentioned about one of the things that you do is vaccinations, right? So going back to school, I remember, and it was 100 years ago for me, I needed to get vaccinated and show proof of vaccination. And so parents probably ask a lot of questions about that, like, is it safe for my child to get vaccinated?
It is safe, and it's very important to continue an on-time vaccination schedule.
Okay, and we have a brief amount of time for one quick question. Should children get their yearly physical?
Definitely, definitely. This is so important. It's important to keep on top of their growth and development and make sure those are progressing on time. And also, this is a great opportunity to talk with your doctor about, the stresses and the changes that we've experienced this year. Nutrition and exercise are harder for most families, and it's a lot of mental health stress as well.
Okay, so thank you very much, Dr. Downs, for spending some time with us. And if people want to make an appointment with you, they can, right? They
Absolutely.
can go through my LVHN.org and make an appointment with the physician or call our access center. So thank you very much for your time.
Thank you.
Thank you for joining us. We hope that you found the information valuable.
Next month, our topics will be breast cancer awareness, vaccines, and trauma.